Hello, and thank you for joining this session where we'll be hearing about diet, gut health and Parkinson's. I'm Catherine, the Research Communications Officer at Parkinson's UK, and I will be leading us through this session. So I'm delighted to be joined by Filip, a clinical neurologist at Helsinki University Hospital in Finland, Lynne, a cognitive neuroscientist from Sheffield Hallam University, and finally Richelle, who was diagnosed with early onset Parkinson's and is a practicing dietitian. I would also like to thank Laurel and Mark, two of our dedicated volunteers, as well as the larger organising group for their help in shaping this session. As you listen, if you're here live, please do ask any questions. We should have time for some of these at the end. You can also find extra reading and more information on this topic in the additional resources and further reading sections of the event website. I particularly encourage you to look at the information on research into supplements, as we will not be covering this in as much detail as we would have liked to. So let's get started with our first talk about the links between the gut and the brain. This is quite a technical talk, so please look at the additional resources for supporting information. We'll then move on to how research into probiotics might help and cover some practical tips and advice on diet and nutrition. So over to you, Filip.
Hello, my name is Filip Scheperjans, and I'm an adjunct professor of neurology here at Helsinki University Hospital in Finland. I very much thank the organizers for inviting me to contribute to this event, and here I will give you an overview of the gut-brain connection in Parkinson's disease. Here are my disclosures. So before we continue to the gut-brain connection, it's really important to understand that the aggregation and spreading of abnormal proteins is an important element in the development of Parkinson's disease, but also of other neurodegenerative disorders such as Alzheimer's and ALS, for example. So essentially meaning that we can have proteins that have a quite normal function usually in our body, but they, under certain circumstances, they can aggregate and then form these toxic aggregates or clumping together and then spread through the nervous system. And as you can see on the lower left, so this is basically Braak originally proposed how this may actually happen in Parkinson's, is that the whole process in the brain starts in the lower brainstem and in the olfactory bulb, so close to the nose. And then basically the pathology spreads from one nerve cell to another upwards in the brain, and along the way, the nerve damage develops. But why we're interested in the gut in Parkinson's disease? Well, for several years, it has already been known that there is actually quite some of the same alpha-synuclein pathology in the gut in Parkinson's as there is in the brain. And also, Parkinson's patients have a lot of gastrointestinal symptoms, which basically cover the whole gastrointestinal tract from the mouth to the anus, so starting from salivary excretion problems to really defecatory dysfunction, and any part of the gut in between can basically be affected in Parkinson's disease. And when we look at how this develops over time, then it's actually very interesting to see that in many patients that suffer from constipation, for example, that this has been present already years before the onset of Parkinson's symptoms, so before the movement disorder actually set on. And in some studies, this delay was even up to 20 years. On average, it's probably less, let's say maybe 5 years or so, but there is a significant fraction of patients or group of patients that really reports have gastrointestinal problems before their movement problems started. And the same is true for certain sleep disturbances, disturbances of the sense of smell, and also for certain psychiatric problems. And only at a later stage, we actually then see the motor symptoms, and that is the point where we make the diagnosis of Parkinson's disease. So really a long period before we can actually diagnose it. But what happens during that time? So recent studies actually suggest that there may be at least 2 types of Parkinson's disease, which is very important because we have had problems, with the high variability of symptoms from between one patient and another. And this really helps us to better understand this. And so importantly, we now think that there may be 2 subtypes of Parkinson's. One is called body first and one is called brain first. So let's have a look at the body first subtype first. So there is evidence that in these patients, actually the pathology, so the alpha-synuclein aggregation and clumping, may actually start in the body and most probably in the gut. And when this happens, then this can basically start a chain reaction where the pathology develops here, but then it starts spreading along nervous structures, for example, the vagus nerve, upwards, it may also reach the heart and eventually reaching the brainstem. So we can see gut problems and heart problems, for example, blood pressure regulation problems and these kind of things already at an early stage. And then when it reaches the mid of the brainstem, then we may see sleep disturbances such as REM sleep behavior disorder, symptoms where patients act out dreams, violent dreams, have nightmares, and so on. And then it further spreads upwards to the midbrain. And only when it reaches the midbrain, we actually see the motor symptoms of the disease, when the dopamine producing cells are starting to die. And after that, it really starts progressing further into the brain. But importantly, the sleep problem starting before the actual motor symptoms develop. Whereas in brain first patients, the starting point of the pathology is actually in the brain, and most likely only on one side of the brain, which also helps us explain why Parkinson's may have an asymmetric onset, which is very frequent, that it starts on one side of the body. And then it spreads basically downwards to the midbrain. And rather early, we would see the motor symptoms because the midbrain is early affected. And only after that, when it spreads downwards, it reaches the sleep centers. And then we start seeing the sleep problems. And then it may further spread to the heart and gut and body and so on. So essentially, after some time, both of these types may look the same, but in the beginning, they seem to be different. And in particular, the sleeping problem may be one important difference between the two, basically meaning that in the body first type, we see the REM sleep behavior disorder happening before the motor symptoms, whereas in the brain first type, it happens after, if it happens at all. I mean, not every patient necessarily have this symptom. But this is very important to understand, that the importance of the individual pattern of Parkinson's pathology and symptoms in the individual patients. And this is really a change of our thinking with respect to Parkinson's. But when you're interested in the gut, and the gut may be actually the starting point in certain types of Parkinson's, I mean, then you're really also interested in the gut microbiota. So what is the gut microbiota? The microbiota is basically the whole population of microbes that we carry with us in our body, so bacteria, viruses, fungi, and so on. And those are in huge numbers. Well studied, best studies is clearly the bacteria out of these. So we really know much less about viruses and fungi in Parkinson's. Important to know that the vast majority of these microbes is living in the large bowel. And actually, it seems that these microbes, in particular the bacteria, can actually code up to 100 times more genes than our own genome. So basically meaning that only 1% of the genes that we carry with us and that are active in our bodies are actually human genes, whereas the majority is actually bacterial genes. And these bacteria have vast impact on our organism. They can produce neurotransmitters and other metabolic products such as short-chain fatty acids, for example, that can help reduce inflammation. They are in intense interaction with the immune cells, regulating inflammation in the gut, but probably also in the brain, which is important for the progression of Parkinson's disease, because we think that neuroinflammation in the brain is an important determinant of disease progression. They can also have an influence on the vagus nerve, so direct signaling through the nerve to the brain. And so basically a direct communication between the bacteria and the brain. And also basically, in addition to the connection with the vagus nerve, also connection through the bloodstream. And many ways that the bacteria can influence brain function and brain health. And that is why we're so interested in the microbiota, because we think it can help us to understand and hopefully the Parkinson's disease development and hopefully find new treatments. So with respect to Parkinson's disease, there is now quite some evidence that there is actually a low-grade inflammation in the large bowel of many Parkinson's patients. This seems to be going along with a reduction of certain bacteria, short-chain fatty acid-producing bacteria, and an increase potentially of other bacteria that may be harmful, actually. So basically, the composition of the microbiome is changed in Parkinson's, which seems to be quite pronounced in a certain subgroup of subjects. Again, emphasizing the need for the individual constellation of symptoms and findings in Parkinson's. So it's not the same for everyone, but there is on average changes of the microbiome towards a more inflammatory composition. And it may be that this inflammatory situation here may predispose the alpha-synuclein that is naturally in the gut nerve cells to actually form these aggregates. And then it could start a chain reaction where this alpha-synuclein basically spreads through the vagus nerve and eventually reaches the brain and starting the pathology or spreading the pathology to the brain, as we previously discussed. In addition, as I said, the bacteria can probably also, there's evidence for a quite clearly changed metabolism for lipids, for example, also protein and fiber product metabolism, so which may also impact the brain in Parkinson's. So we're getting more information about that. There is evidence that bacteria composition is in connection with disease progression. So when certain bacteria, such as Prevotella, are missing, it seems that Parkinson's progresses faster than in other patients that have higher levels of these compounds. So we may see, an impact on local and also whole body inflammation. With respect to probiotics, lactobacillus has actually been in several studies shown to be increased in Parkinson's, so there's definitely not a lack of lactobacillus in Parkinson's patients. However, there is some initial evidence that mixtures of probiotics may have a moderate efficacy to treat Parkinson's constipation. So this is not as efficient as real constipation medication, but for let's say less severe constipation, it may be an option to try to use these kind of probiotics. In terms of fecal microbiota transplantation, so basically trying to correct an abnormal composition of the gut microbiome by giving gut bacteria from a healthy donor to a Parkinson's patient, we have seen several reports of uncontrolled studies that were quite encouraging, mostly from China, but also from Israel recently, that showed improvement of motor symptoms and non-motor symptoms in Parkinson's patients after fecal microbiota transplantation. However, these were all non-controlled studies, and so we should take this with a grain of salt. We here in Helsinki are currently conducting a randomized controlled trial on this treatment, so we will hopefully know more in about a year's time. And there's also a trial in Belgium going on investigating this. So we still have to wait a bit to get better evidence. But one important final thing I would like to mention, not related to the bacteria necessarily, is the connection between the upper gastrointestinal tract and motor fluctuations, because that is the upper gastrointestinal dysmotility, so basically altered peristalsis of movement in the stomach and in the esophagus, is probably the most important reason for what we call unpredictable motor fluctuation. So basically when you lose the connection between medication intake and symptom control, and you experience these surprising off periods or surprising dyskinesia periods that are not in connection with your medication intake. This is a sign of clear dysfunction of the upper gastrointestinal tract in Parkinson's, and this is very difficult to treat by changing oral medication. So in these cases, one should consider device-assisted treatments or transdermal applications of medications or dissolvable levodopa tablets to treat these motor fluctuations, because otherwise it is very difficult. So overall, the evidence is accumulating that in a significant fraction of patients, the origin of Parkinson's may lie in the gut, and the microbiota play a role, but we still need to learn more about how it impacts Parkinson's disease. The microbiota probably impacts disease progression, medication efficacy, local and systemic inflammation in Parkinson's. So it is really a highly studied field at the moment, and hopefully it will reveal new treatment opportunities. But we need to consider that there is variability between patients. And the gut problems in PD may impact medication efficacy, and probiotics can be used as a moderate efficacy treatment for constipation. For fecal microbiota transplantation, we still have to wait until we get results from randomized controlled trials. So thank you for your interest, and thanks again for the organizers for inviting me.
Thanks, Filip. That was a really interesting talk. So now we're going to hear from Lynne to hear more about probiotics and the research that's going on in Sheffield.
Hi, thank you, Catherine, and welcome to everyone. I hope you enjoyed the talk. So I'm going to talk to you about the gut microbiome and Parkinson's disease and give you a little bit of information about a project that we've just recently completed within our Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University. A little bit about the gut-brain axis. Now, I know you've already had lots of technical information, so I'm going to try and keep this relatively succinct. The gut-brain axis is important because there is a strong link between the brain and the gut, and there is permanent communication, and it's a two-way interaction. But it's important in terms of the stability of the microbiome within the gut. So what we know that in eubiosis, you've got a healthy gut. It's marked by a high diversity of different species and a real grand abundance of microbial populations. Whereas the flip side of that is what we call dysbiosis. Now, in dysbiosis, you've got a pathogenic state of the gut. There's a loss of microbial diversity. You might have symptoms like leaky gut, for example, where the epithelial wall of the gut begins to break down. And usually there'll be a host of other factors associated with the dysbiosis because our gut is really at the center of our functioning and our well-being. It's where we ingest and digest and process all our nutrients. So it kind of impacts all other elements of our functioning if the gut's not working properly. So that's gut dysbiosis and gut eubiosis. Just a little set of figures on the right-hand side there. I've stolen this from the University of Cork. Well, I've borrowed it actually, but I'm sure they won't mind. And so what we can see there, we've got about 100 trillion microbes that live in and upon our body surface all the time. So technically, we are super organisms rather than a single organism. There's about 150 to 1 microbe genes to human genes, which means that we are mostly microbes. And if you linked all your microbes together, they would travel around the planet twice. Importantly, each individual has a unique gut microbiota, which is this. It's as personal as a fingerprint. However, I do want to come back to that because there are some caveats about that. Right, so why does the gut matter, and why does it matter whether the gut is communicating effectively with the brain? Well, as I've said, the microbiome is a layer of microorganisms and includes lots of friendly bacteria. These bacteria are termed commensal, and what that means is that they perform lots of important jobs for us as human beings, and that can be doing all kinds of things like fighting pathogens, helping the immune system, creating short-chain fatty acids, which are really vital for healthy digestion and a healthy gut. So they work in a huge community, and it's not really meaningful to look at them as individual species. In some microscopic photographs, you can actually see that the microbes are tied to each other. So they work very closely together in that sense. So the gut and Parkinson's disease, well, it's long been known that there are links between gut dysfunction and Parkinson's disease. Presently, there are more than 4 million papers on gut dysbiosis and Parkinson's disease. The literature suggests that constipation, so a change in the gut's behaviour, may precede the condition by at least a decade. So this could really be a nice marker for later Parkinson's disease if we could detect that early. James Parkinson, the person you I'm sure are aware, originally diagnosed the condition, felt that gut dysbiosis was a core symptom and was evident very early on in the condition. But of course, symptoms may vary across the lifespan and with age. Importantly, we can see on this little schematic here on the left, it's just a general picture of how, if you've got an abnormal gut microbiome, that you get problems in terms of short-chain fatty acids, that's SCFA. They're really important for gut health. So production of those goes down, constipation goes up, inflammation, which causes all kinds of other problems as well, other than gut problems. So it's going to cause problems with digestion of food, but also metabolism of any medications that people might be taking. And that's an important factor. We need the medication to be effective and to be absorbed well. And also may cause inflammation and other problems. But the important thing is there's a motor highway between the gut and the brain. And we can see that in terms of the vagus cranial nerve. And proteins and chemicals and molecules are able to be transmitted from the gut directly to the brain via this route. So we did a study with probiotics. Why would you want to use probiotics and why improve? Well, probiotics are a relatively safe way to deliver healthy microbes to a dysbiotic gut. They make medication better absorbed and also facilitate better nutrition, because obviously the gut's now absorbing more from food that's been ingested. It's potential to have a positive effect on the quality of life for PD patients, and it's much easier to implement than changing diet dramatically. And there is possibility that they may thus offer some symptom amelioration through reorganization or reconfiguring of an unhealthy microbiome. So briefly in our study, it was a feasibility study, relatively small. We had 30 patients with Parkinson's disease. It was a randomized controlled trial, so patients didn't know whether they were taking a probiotic or a matched placebo. Half took Simprove probiotic and half took the placebo for 12 weeks. We gave them lots of different behavioral measures at baseline and then at follow-up at 12 weeks later. We also extracted fecal samples at baseline, so this is before probiotic and before placebo, before anything, and then again at 12 weeks after either the probiotic or placebo. And there's just a nice little real photograph of microbes there. So they look a little bit scary, don't they, actually? So what I want to show you here is some preliminary baseline species data. It all looks very complicated, I know. This is the probiotic group. Each column represents a single person and their microbiome and the species that are within that microbiome. But what I'd like to highlight to you is that if we look across those microbiomes, we can see that there are species that are present in each one. So I think for us moving forward, we want to establish whether there is a general Parkinson's disease signature microbiome and then an additional personal one. And that's the part that constitutes the unique signature, the personal one. If we can see that there's a general Parkinson's disease microbiome signature and it's related to behavior, then we can move forward in terms of manipulating these species. So preliminary findings were that the microbiome is changed after 12 weeks on a probiotic, but the microbiome also changes after 12 weeks on a placebo. So it's a very dynamic environment. The changes with the probiotic indicate that there are more species and there seems to be greater abundance of what we might call the good species after the probiotic use. We need to investigate our data further and look to see if there are any changes in symptoms as well. So we're still working through the data. There's quite a lot to do. Anecdotally, our patients have reported, those that were in the probiotic group, that they had significant improvement in bowel function and well-being. So the take-home message is the microbiome is in direct and constant communication with the brain and vice versa through a two-way pathway and through chemical signaling. Dysbiosis due to microbiome disruption can cause significant problems that might impact neurological conditions because of this relationship between the gut and the brain. Probiotics can deliver healthy bacteria quickly and effectively to the gut, which may help to reconfigure or change the composition of the microbiome. Our patients who completed the probiotic section all reported feeling significantly better, having improved bowel habits, but we need to analyse our data further to make sure that our findings are robust. And research in human participants really must continue in this direction for neurological disorders and in Parkinson's disease specifically. So finally, just like to thank everyone, people with Parkinson's disease who make our research possible and for whom we are doing this research, and Parkinson's Disease UK for all the great work they do. That's just a list of all the other Parkinson's disease projects we've got going on. And there's my email in the middle at the bottom if you want to contact me, if you want to have further information or take part in any of our studies. We have a growing community of Parkinson's disease researchers now in Sheffield. Thank you.
Great. Thank you very, very much, Lynne. That was a really interesting talk. And I'm now going to hand over to Richelle, who's going to give us a bit of an insight into diet and nutrition from a dietitian's point of view.
So, thanks very much. Yeah, I'm Richelle Flanagan, and I'm here to talk to you about essential diet and nutrition considerations for people living with Parkinson's disease. As mentioned, I was diagnosed with young onset Parkinson's disease 4 years ago. And subsequent to my diagnosis, I actually travelled to the World Parkinson Congress in Kyoto. And when I was at that Congress, which is an amazing Congress of both people with Parkinson's, healthcare professionals, neurologists, and family members, one of the areas that was a bit missing was the area of nutrition and diet for people with Parkinson's. So subsequent to that Congress, I actually wrote an article for my professional body magazine highlighting basically the missing pieces of the puzzle in terms of management of people with Parkinson's. So today I'm going to just bring you through some of the research with regard to some key areas of consideration for people with Parkinson's. So the first area is weight loss or weight gain, looking at the gastrointestinal system, bone health research. And I'm going to actually tie that into a nutrition survey I did as a member of the Dublin Parkinson Society of Ireland. And then I'm going to summarise with some of the diet and nutrition considerations for people with Parkinson's or those who are working with them. So firstly, with regard to the research around weight loss. So we know that through research that decreasing body mass index, so that is your weight in kilograms divided by your height in meters squares, your BMI, is associated with higher motor and total UPDRS scores. So these are the scores that basically gives an indication of whether our disease is progressing or not. So higher the score is the worse for us. The other thing is that clinically significant weight loss within the first year is independently associated with dependency, dementia, and death. Now I know that's kind of scary, but I think it's really important that people are aware of this so that they keep an eye on their weight, or their family members keep an eye, and also the healthcare professionals keep an eye on weight in people with Parkinson's. Research has also shown that prevalence malnutrition can affect up to 60% of people with Parkinson's, and up to a quarter can actually be malnourished. And this can have serious impacts, one of which is the development of sarcopenia. So recent studies show that 56% of people with Parkinson's can be sarcopenic, and actually there should be 44% of probable sarcopenia. And sarcopenia, if you see the little images on the right, is basically where you lose muscle mass. So as we get older, we can naturally lose muscle mass, but it's a higher prevalence in people with Parkinson's. And the issue with that is it can lead to a higher fall frequency because of the weakness in terms of the loss of muscle. The other thing is, in terms of weight loss, there's a couple of factors that can affect it, one of which is loss of smell. So research shows that up to 90% of people with Parkinson's lose their sense of smell, and up to 54% can lose their taste sensitivity. And research shows that actually smell, the lack of smell, can impact weight loss. And if you think about it, when you're eating your meals, it's the smell that basically makes us want to eat. So if you can't smell, it just doesn't, taste as nice, and then maybe not eat as much. Also then we've got symptoms. So dyskinesia, rigidity, tremor can affect weight loss. And obviously these symptoms can affect the ability to prepare, cook, or eat food. And you'll see the images here on the top right. There's a woman there with the tremor. The bottom image is someone who has dystonia, which is basically where the hand becomes clawed. So both of these can obviously impact how one eats. And this is a colleague here of mine, Matt Eagles, and many of you probably know, in the UK, and he kindly shared this video with me. And it shows you here is him being dyskinetic, and obviously there's a number of issues here. One is trying to hold the utensils, two is trying to hold the plate, and obviously three is trying to eat the food. So you can imagine there's a lot of energy being burnt up there, and a lot of effort. And many people with Parkinson's would give up. Not the positive Parky Matt, he'll keep going, but many people would give up. So the other thing that can really impact weight loss is also dysphagia. So dysphagia is where you have a problem swallowing foods. And obviously, if you've dysphagia in your coughing, it's going to put you off eating your food. So research shows that 50 to 80% of people can get dysphagia in the early stages of Parkinson's, and up to 95% of people in late stages of Parkinson's develop dysphagia. There's also pharyngeal esophageal dysfunction. So that's basically where you have a problem with swallow kind of in the earlier area of the swallow process. And even myself, I had a sensation of having a problem with sort of, having to clear my throat all the time. And I spent a lot of money trying to get an answer to it. And I thought it possibly was the Parkinson's. And it was actually a speech and language therapist in the WPC that said that everybody with Parkinson's should get a swallow assessment at baseline. So I went home and I pushed for a swallow assessment, and lo and behold, my swallow function was actually that of a 65-year-old and not a 47-year-old at the time. So 4 out of 5 people with Parkinson's do not realize they have a swallow problem. And research has shown that in one study that when patients are asked whether they had a swallow problem, only 35% said they did. But actually when a clinician did an objective assessment of them, actually 82% of them had a swallow issue. So in terms of just tying that back again to the Parkinson's survey that we did in Ireland, only 4 out of 10 people with Parkinson's in the study, and we had 82 people take part in it, were weighed by their GP or neurologist. 60% of the respondents had lost weight unintentionally. So that's a huge gap in care if it's not been picked up. 30 to 40% had difficulties with holding utensils or cutting and preparing food. 25% experienced problems with choking or coughing when swallowing food, which is the dysphagia. So the other end of weight for people with Parkinson's is weight gain. So a number of people with Parkinson's can gain weight and end up being overweight or obese due to things like impulse control disorders, which can appear through a side effect of medications. It can happen with levodopa, but generally happens mainly with the agonists. Also, there was a case control study done quite recently that showed that actually 27% of the patients with Parkinson's actually had an eating disorder versus the controls. And actually food addiction was, again, quarter of the population. And you see there the age range was, early onset to later onset. And it was higher in women, a whopping 53% versus the 37% in control. And this is something that I hear a lot in terms of people mentioning issues around craving foods, etc., overeating. And obviously in terms of deep brain surgery, which is used to help people reduce their dyskinesia or their tremors, and people can gain weight and gain up to 5 kilos of weight after DBS, which obviously has other risk factors in terms of developing other chronic diseases. So these are all things that need to be taken into account. In terms of the gastrointestinal system, we know through research that up to 90% of people with Parkinson's can have GI symptoms, up to 77% report constipation, and up to 100% can report up to gastric emptying delay. So again, just tying in with the Parkinson survey results that we did, the most common bowel symptoms were constipation, wind, and/or incomplete bowel movements, and 6 in 10 had constipation. So very much ties in with the research. In terms of bone health, the prevalence of osteopenia and osteoporosis is higher in people with Parkinson's than age-matched controls, and is higher again in women than men. Fractures are higher in women. So one study showing 51% of Parkinson's versus 11% in control. And bone mineral density is lower in both men and women, but more so in women. And also in terms of vitamin D levels, there are insufficient blood levels in people with Parkinson's, up to 50%. And over 50% of people with Parkinson's take inadequate vitamin D intake. And this shows in terms of our survey, we found that 50% of people were not taking vitamin D. So very much marrying the research results. So now coming on to the diet and nutrition considerations out of all that research. So one of the key things is meal composition. So as I mentioned there, up to 100% of people with Parkinson's have slow gastric emptying. So that means basically your food is slower to empty out of your stomach into your intestines. So this is a key thing in terms of medication. So when you take your levodopa, it has to go down, back of your throat, into your esophagus, down into your stomach and into your intestines. And it's in the small intestine that your levodopa is absorbed. But if you have a slow emptying stomach, basically the tablet gets stuck in the stomach and the gastric acid can break down that tablet. But also in terms of you have a high fat, high protein meal, it slows down the emptying of your stomach, which means that it slows the medication getting to your intestines, which for a lot of people means that basically their symptoms don't, improve because basically the medication is stuck in their stomach. The other thing then is your meal timing. So in terms of your levodopa, it competes for absorption with protein amino acids. So your protein foods like your chicken and your fish, etc., breaks down into amino acids, and they basically cross the blood-brain barrier, and exactly the same place that levodopa crosses. So if you have your time your medication with your meals, it means that there's a very high likelihood, and research shows, that you won't get as much levodopa into your brain. So we advise you take your levodopa half an hour to an hour before meals, or an hour to 2 hours after meals. Also avoid drinking milk with your medication, because milk has a high protein content, and avoiding the protein heavy meals. So this is a typical Irish meal, very much the same in the UK. And you can see here, huge amount of protein and quite a lot of fat. This would be a typical Irish, portion of a steak on a plate. This is what it should be. Okay, so a lot of people don't realize that they're actually eating too much protein in general, whether you have Parkinson's or not, but obviously has a bigger impact for people with Parkinson's. And people often ask, what is the diet that I should be eating in terms of trying to slow progression of Parkinson's? Now, unfortunately, there's very little research in terms of specific diets to slow Parkinson's. There is only one study that I'm aware of, and it's the MIND diet, which is basically a combination of the Mediterranean diet and the DASH diet, which was shown to have an associative link that it might slow progression in older people. So that's only one study, but really a lot more should be done. But the research in terms of reducing the risk of developing Parkinson's is quite high for using the Mediterranean diet. Now, this is an associative link. It's not a causative link. But what I say is that basically the Mediterranean diet is not going to harm you. So there's no risk of actually following this diet. So this makes sure that you get plenty of vegetables into your diet, plenty of whole grains, so whole grain rice, whole grain pastas, whole grain breads, couscous, quinoa, all of those good grains. Because both of these foods basically help, one, in terms of preventing constipation. So constipation basically means that your levodopa can get stuck in your gut, okay? But also, as Lynne mentioned, your constipation can actually lead to an overgrowth of unhealthy bacteria, which is potentially associated with worsening of Parkinson's. And the other thing is, in terms of your Mediterranean diet, is making sure you're getting oily fish in. So things like your mackerel, your sardines, your trout, your salmon, very good in terms of omega-3 fatty acids, which are beneficial to our health. Making sure that we get protein in, but choosing healthy ones like turkey, chicken, fish, eggs. You can have some red meat, but keep the portions to 2 to 3 times a week. And that's only 3 ounces per serving. So max would be 9 ounces of red meat in the week. And that is to help your iron levels and your vitamin B12 levels, which are very important for Parkinson's. And then keeping the treat foods to a minimum. So generally speaking, 2/3 of your plate should be, the healthy grains, your vegetables, eating fruit throughout the day, and then keeping a smaller portion of meats and fish, etc., and protein on your plate. So just in terms of, Lynne has mentioned about the microbiome, but I'm just going to highlight 2 key areas in terms of bacteria that can impact people's symptoms of Parkinson's. The first one is a bacteria called Helicobacter pylori, which is generally in the stomach, but can be in the small intestine, and it interferes with levodopa absorption. It can increase the risk of vitamin B12 deficiency, iron deficiency, and vitamin D deficiency. And also then there is small intestinal bowel overgrowth, so an overgrowth of unhealthy bacteria, which again can interfere with levodopa absorption, vitamin B12 deficiency, and possibly decrease your vitamin D. And the thing is, vitamin B12 deficiency mimics a lot of the Parkinson's symptoms. So things like brain fog, fatigue, muscle weakness, falls, forgetfulness, depression, and neuropathies. So before you kind of think, oh, my disease has progressed, it may be that you're deficient in vitamin B12. And as we get older, we actually start to reduce our absorption of vitamin B12, and then you put Parkinson's on top of that. And also, the longer you're on levodopa, the higher the risk of being deficient in vitamin B12 because it reduces the absorption. So you need to check for those. So a lot of people ask, does nutrition intervention work? And I'm just going to show you here a study that was done in 141 people with Parkinson's in Brazil. So basically, they had found that 67% had an abnormal nutrition status, a quarter of them were malnourished, and 42% are at risk. Their poor nutritional status affected their depression and anxiety. They did a 6-week nutrition intervention with a dietitian nutrition nurse. They used oral nutritional supplements for those who are malnourished. They made sure that people got the 30 to 35 grams a day, which we advise for people with Parkinson's to take. They ensured that people who were deficient in vitamin B12, vitamin D, or folic acid, they were given supplements, and they were kept on the appropriate amount of protein, which is about 0.8 to 1 gram per kilogram body weight. And they did a protein distribution diet. And that is where they put most of the protein intake for the day in the evening time, so that it reduced the impact of interfering with levodopa absorption. So the results were pretty astounding. So it showed in terms of the mental part one of the UPDRS that there was a significant change and improvement. It showed in terms of, you can see here, emotional well-being, activities of daily living, mobility, cognition, bodily discomfort, anxiety, depression. They all radically improved. The other thing was that their body mass index improved, not significantly, but it definitely improved. And also their malnutrition score radically improved as well. So, I mean, that's just in 6 weeks. So the author basically said nutritional assessment should be a standard approach of care for people with Parkinson's. And whilst actually there is further research needed in terms of progression of neurodegenerative conditions like Parkinson's, however, we're disregarding the basic needs of people with Parkinson's to have their nutritional needs assessed, because it has an impact on potentially worsening Parkinson's disease if it's left unassessed. And this obviously has a big impact on quality of life. So do we wait or do we act? And I think we need to act. So just to kind of summarize here in terms of the poor access to dietitians and nutritional care in Ireland, 8 out of 10 neurologists had never asked a Parkinson's person about their diet. 9 out of 10 of GPs never asked about their diet. 8 out of 10 of the people with Parkinson's were never referred to a dietitian. And the average was 10 years that people had this Parkinson's. And only 1 in 10 people with Parkinson's asked to be referred to dietitians. So we have 2 problems here. One is the healthcare professionals are not asking the question. And 2 is people with Parkinson's don't realize how important nutrition is. So this is like astounding. And I think a similar research study would be very beneficial to be done in the UK, the Parkinson's over there. So key actions for people with Parkinson's that I would say to you to take away: ask for a referral to a speech and language therapist to assess or swallow. Ask for a referral to a dietitian, ideally one with neurology experience, but just ask anyway, because the more you ask, the more they have to basically fulfill that need. Ask for a referral to an occupational therapist if you have difficulties in cooking or eating. Ask for a healthcare team professional to check your vitamin D, vitamin B12, iron and folate. Ask for a review of your bone health and possibly a DEXA scan. Check your weight for loss or gain, and the health professionals should be checking this regularly. Eat like a Mediterranean. Time your medication separate to your meals. Aim for a daily bowel movement. Use a food diary to monitor your symptoms in relation to your medications and your foods. And discuss options such as Helicobacter pylori, small intestinal bowel overgrowth, or protein-restricted diets in relation to medication fluctuations with your team. So just in terms of finishing off resources, I got involved with my professional body and updating our resource around diet and nutrition guide for people with Parkinson's, because it was well out of date. So you can find that on the Parkinson's Association of Ireland website. There's also a good guide on the MJ Fox website, which was reviewed by a dietitian. And then in terms of more sort of for the healthcare professionals, the BDA, the British Dietetic Association, their neuroscience group updated their best practice guidelines for dietitians on nutrition management of Parkinson's. And then also ESPN, which is basically a big European body around clinical nutrition management. They did publish guidelines in 2018 with regard to the management of Parkinson's in neurology. So thanks very much for your time, and I look forward to the discussion and obviously answering questions in due course.
Thank you very, very much, Richelle. And great tips to end on as well. So thank you. So yes, we're gonna have a bit of a discussion now. There will be time to take the live questions in a bit, but I'd like to start the discussion with a few questions that we know are commonly asked from the Parkinson's community. So a few of them have been answered in the talk. So I want to first of all go to Lynne and say, so should people go out and try probiotics now if they have Parkinson's? What's your feelings towards this question?
Yeah, that's a common question that I get asked. And it's a difficult one to answer because actually I don't want to make recommendations, for people to go and spend money on things that are expensive. We do know that probiotics are generally harmless. I think if you're going to take one, choose a really good one and one that's involved in scientific research. That's why we chose Simprove. But I would say, to refer back to Richelle, most important is to have a good diet. So you could have a probiotic as a supplement, but definitely the focus should be on getting good nutrition as much as possible through diet.
Great, thank you, Lynne. And I guess to build on that, probably going to you, Richelle, if we're thinking about supplements more generally, you've mentioned B12 and vitamin D in your talk. But what about some of the other supplements that people might read online that people should be taking if they have Parkinson's? Can you just say a bit towards that?
Yeah, well, I think the evidence isn't out there for a number of the supplements that are out there. So one would be N-acetylcysteine that people... there's some research to show it might have a benefit in terms of the glutathione, which can be low in people with Parkinson's. But actually, I just saw a paper quite recently, and it's just not there. The research is not there for people to take some of these supplements. So, I think what I find, even in people who haven't got Parkinson's, when they appear with lots of supplements, it always says to me that they're trying to basically desperately fill a gap. And often then when we go through their diet, actually, they haven't got the foundations right first. So their quality of life is affected because their medications aren't working well, and that's because maybe their timing of their meds is wrong, or they're eating a very high diet and high in protein, which is having an impact. So we need to kind of get the basics right first. Would be what I say before taking supplements that we don't have any idea that has a benefit. But you can see from that last study that I showed, people getting the vitamin B12, the vitamin D. These are research based and are really important in terms of the health of people with Parkinson's. And I suppose just tipping on the question about the probiotics, people ask me a lot of that as well. And I would agree with Lynne. Generally, the advice at the moment is not to take probiotics until we have a clear impact in terms of Parkinson's. The Simprove is really interesting because it definitely is having an impact. And we don't know, obviously there's different strains in that Simprove, because we know in terms of a lot of the studies of Parkinson's that we tend to be higher in lactobacillus and bifidobacteria. And so the question is, okay, a lot of the supplements that are probiotics that are on the shelves are high in these probiotics. So are we making things worse by putting those in? Or is it that basically the body is feeding back and trying desperately to, counteract? So what's really interesting in the Simprove is it has a mixture of different ones. And I think it's the rhamnosus is one that's really in there as well, Lynne. But I just think this area is really exciting. I do know from some people with Parkinson's who take the Simprove, and it has improved their bowel motions and their constipation. I was involved with a study, you might know her, Sylvia Dobbs in KCL, and she did a study where she got people to take laxatives, and it improved people's rigidity. It actually reduced it. And they're the same as you, Lynne, in terms of it showed that potentially they're questioning it's not just improving constipation, but it may be that it's affecting the microbiome. So it's just really exciting. But I kind of would say just hold fire and sort of wait for a little bit more research, which I'm dying to see what comes out of your study, Lynne.
Lynne, over to you. I can see you've got your hand up.
Yeah, thanks. Can I come back to that? Thank you, Richelle. Yes. What we're finding, a lot of the research about Parkinson's disease and probiotics comes from lab-based work. And I think Catherine and I were chatting about this the other day, and often animal-based work as well. So where you've got genetically similar animals, well, they're identical and they all eat the same food. And the point of that is that they're good experimentally, but actually they don't correspond well to humans. Now, in our data that we're just still mining the species data at the moment, I'm not seeing an abundance of lactobacillus in the Parkinson's disease patients at all. So I can't see that at the species level, but we need to look at the phylum level next. That's what we're going to do next, because sometimes these species hide and it's very hard to capture their DNA. So one of those things could be a measurement issue. But importantly, I think what we're showing, rather than by adding in a couple of probiotics, you get an increase in those species. By adding in the probiotics, you get a shift in the whole configuration of the microbiome because it's a community. So that's impacting species, the different species in different ways. And that's the bit that we need to untangle. Is it increasing, the more commensal, the good bacteria, and decreasing the less helpful bacteria? And that's what we'd want to see before we could make a recommendation about that as a therapeutic aid. And one final point, we conducted a study with teenagers with brain injury and without brain injury, and we looked at their vitamin D intake, and almost all of them were deficient. And these are normal, functioning, healthy young people. So on the basis of that, I would say that most people should probably take a vitamin D tablet, particularly in the Northern Hemisphere where we live, where there's not a tremendous amount of sunshine. So that's what we found, and we really didn't expect to find that. So I would imagine in older people, particularly where their diet is limited or their mobility is limited, so their capacity to create food and cook food is also limited, there's going to be vitamin D deficiency.
Yeah, absolutely. And I think one of the things is, and I mentioned there, is to get your vitamin D level checked, because if you're insufficient or you're deficient, you'll actually need a high dose vitamin D to bring you up to normal before you can then sort of take a lower dose. And we just need to be mindful of that at the basics, going back to the basics of checking these things out and correcting them first before trying some kind of, supplement that doesn't have evidence behind it.
Great, thank you both. And I think one final question before we open the floor to questions. It's quite a big one, and Richelle, you've already touched on it, but what's the priority? What needs to be done to further this area of research, whether it's gut health or research directly into specific diets?
Well, I think, there has to be a shift in terms of funding, not away from, pharmaceuticals, but I really think, the whole, gut-brain, like, for example, the probiotics, but also in terms of the use of diet. I mean, you saw from that one study, the impact in a 6-week intervention. I mean, that can have huge implications for people. And also getting in earlier, I know even from my own dietetic professionals, one of the reasons I actually came out as such with my Parkinson's was that some of my colleagues had sort of said, I have someone who has early onset Parkinson's, I only intervene when it's later. And I was going, okay, that's wrong. We need to stop this perception that, it's only when you're older and it's kind of too late. We need to intervene the minute someone is diagnosed, regardless of their age, and intervene all the way along the course. So I think there needs to be research in terms of, like the survey I did, but and obviously that was, we didn't, peer review it, or we didn't have ethics, that kind of side of things. So we need to have a proper study to actually see what the gaps are, because always we have to prove the gaps to get the funding. Unfortunately, that's the way the system works. And then I think we need more specific research into the Mediterranean diet, the MIND diet. Unfortunately, the lady who developed it, sadly, I realized, I think, why is there more research coming out in this? She passed away herself. So that really needs to be taken up and pushed. I know there's a study happening in the States around the MIND diet or Mediterranean diet with a dietitian, but we need more, because we need replication of those studies, and I think we need also to look at the diet in terms of the short-chain fatty acids and the microbiome, and really in terms of probiotics. I think we need the answers, and we need them quicker. So more funding, really, and more focus on lifestyle research.
Great, thank you, Richelle. And Lynne, you look like you've got something to add.
Only quickly just wanted to say we've got a study that you're aware of, Catherine, and we've got a PhD student who's just started, and she's looking at the Mediterranean diet in Parkinson's disease alongside a probiotic arm and a probiotic and Mediterranean diet arm. So it's early days yet. We'll be starting data collection once we've got ethics, probably in January or February, but happy to keep you posted on that as it develops.
That's fantastic news. That's really good news.
Great. Well, thank you, everyone. I'm going to open the floor now to questions. Hello, everyone. I hope you've enjoyed the session so far. I'm delighted to be joined by Lynne and Richelle, who are going to answer some of your questions. I'm afraid Filip couldn't be with us this morning, but we'll do our best to get through as many as we can. So I'm going to kick off with a great question from Becky. And the question is, I'm going to direct it at you, I think, Lynne. How long does it take for the condition to spread from the gut to the brain? What causes changes to start in the gut?
We don't really know. Hi, Becky. We don't really know how long it takes to spread, but we think it's potentially a decade or 2 decades pre other symptoms. At the moment, we're still trying to understand the mechanism by which that might occur, but we already understand a few of the pathways and they're fairly well defined.
Great, thank you. Thank you very much, Lynne. And we'll move on to the next question, which is from Carol. And Richelle, if you could talk to this one. So it's about antibiotics and the thought that they are meant to destroy good bacteria in the gut. And can this be corrected? Also, is there a link between autoimmune disease like Crohn's and Parkinson's due to the link between the bacteria in the gut?
Okay, so thanks very much. That's a good question. There's a lot of meat in that. I suppose I'm going to start with the inflammatory bowel disease. There is a link between inflammatory bowel disease and Parkinson's. What is interesting, though, is those people who are on the anti-inflammatory medications reduce their risk of developing Parkinson's. So definitely there seems to be some, cross kind of linking in terms of the inflammatory nature of both conditions. And in terms of antibiotics, I mean, I know some gastroenterologists use them like a probiotic in some cases. Some of the research would show that sometimes if people with Parkinson's take antibiotics, their symptoms get better. However, obviously, it kind of comes down to the type of antibiotic that's possibly used. And, Lynne might want to speak to this, but in terms of, maybe the microbiome being very specific to a person that maybe an antibiotic might have use in particular people.
Great, thank you very much. Okay, let's move on to the next one. A great question from Jenny, actually, and Richelle, this might be one for you. She's heard that introducing a time-restricted eating could be beneficial for Parkinson's. Is this true?
Yeah, well, there's a lot of interest in this whole area of sort of restricted time eating and, in terms of fasting effectively. Some people sort of say to fast for sort of 14 hours a day. But one of the things I kind of feel is that, at the end of the day, if people sort of stuck to sort of a healthy sort of diet in the main and, finished, had their meal, say 6 o'clock, 7 o'clock in the evening and didn't eat again until 8 o'clock the next morning, that is a good fasting period without having to kind of go into really sort of, really high-end restrictive fasting, because we've got to remember that, a lot of people with Parkinson's are older people who may be low in weight to start with, and then you restrict their diet. There's other ramifications that can happen. But there's very interesting research showing the benefit, and yes, in terms of obviously the microbiome, there's a lot of sort of research showing that it has a beneficial impact. But whether one has to be, fasting excessively, there's still a question mark over that.
Great, thank you very much, Richelle, for those insights. Okay, we've got one through from Clive, I believe. So we've got, although the microbiome can be changed, my understanding is that will soon revert once probiotics are stopped, so that supplements must be maintained for clinical effect. We'll start with that part of the question. Lynne or Richelle, do you have any comments on that?
Well, we don't know. We don't know what kind of gravitational force keeps the microbiome in check and keeps it in balance. And we don't know how long you need to take a probiotic supplement for it to be effective. I mean, there is evidence that a short term on probiotics is effective, but then we don't really know what happens to the microbiome after that period. So, yeah, we need absolutely more data on that. And that's one of the things I'm particularly interested in. My gut feeling, excuse the pun, is that we probably need to take probiotics for longer than 12 weeks. That would be my answer.
Great, thank you. And the second part of his question is about dehydration, which is quite common. Do you think it can cause microbiome changes as well as increasing constipation?
Well, I'm not familiar in terms of it necessarily changing the microbiome, but certainly in terms of constipation, yes, without a shadow of a doubt. Not taking enough fluid, along with not taking, a good mixture of fibre-rich foods in terms of insoluble and soluble fibre foods will definitely lead to constipation. And the issue with constipation is it allows, I suppose, the sort of more pathogenic bacteria to sort of thrive. So we want to try and keep your bowel, as regular as possible and ideally moving every day to help that. So along with having a good, healthy, balanced diet, helps that mixture of good bacteria, which is really important and has been associated with potentially slowing progression. But, we still haven't got absolute evidence on that. But at the end of the day, there's no negative impact from not eating a good, healthy diet. But certainly fluid and things with people with Parkinson's, the research would show that they often don't realise they've kind of lost their autonomic ability to recognise that they're not drinking enough. So, people need to be getting in, at least their 1.5 to 2 litres, and depending on your body size, more, and heat, etc., more fluid in the day. So yeah, that's a really important part of one's diet that many people forget.
Great, thank you very much, Richelle. And the next question, again, might be for you, Richelle. Is there any evidence that omega-3 or omega-6 can be beneficial to take for people with Parkinson's?
Well, there's a lot of evidence that omega-3 in particular is very beneficial, and it's about, taking the healthy fats in the diet. So, that includes omega-3, ideally trying to get it from fish, your oily fish, your salmon, your mackerel, etc., once or twice in the week. There is benefits of omega-3 in terms of the stomach health and the sort of colon health as well. There is some research showing that it potentially has benefits. Lynne, again, might speak to this in terms of the microbiome. There's a lot of research in utero in terms of babies that, omega-3 is very important for the brain development. In terms of Parkinson's, there's not enough evidence to say, definitely take this omega-3 supplement. So I think, again, it's just a case-by-case basis. If you don't like eating fish, yes, you can take one, but we have to kind of have caveats in terms of, we're just not in isolation of having Parkinson's and risk for Parkinson's. But for example, there's research to show men who took high-level dose omega-3 supplements had higher risk of prostate cancer. So you always kind of have to, take the individual person and their background medical history into account before you go off and start taking, high-dose supplements.
Great, thank you, Richelle. And a question for you, Lynne, from Peter, about what's the evidence that the vagus nerve acts as the conduit between the gut and the brain?
Well, a lot of the evidence, there is evidence, Peter, about that, but it mostly comes from animal data because obviously they can do experiments with rat labs and mice that look at changing some element of the microbiome and then can check whether that's being transmitted, a protein, say, for example, to the brain via the vagal nerve. So there is evidence for that. I think the picture is definitely more complicated with humans, and we certainly need more research in this area. But it's not unusual for viruses or other things to use that means to move around the body. I mean, that's what we see with cold sores. That's basically what's happening. The virus is moving along a nerve. So there's no reason why this process shouldn't, be a route.
Great, thank you. I think we've got time for one more question, and I've seen a couple of people ask this, and it's about a vegan diet and whether this can be beneficial for Parkinson's. I don't know if Richelle, you can talk to that.
Yeah, well, I mean, a vegan diet, is going to be beneficial because of the vegetarian, protein or fiber that's in there. So in terms of, reducing risk of developing Parkinson's, certainly the Mediterranean diet is probably the one that, is at the forefront. And obviously a big part of that is the vegetable protein, the vegetable fiber, the fruit fiber. So what I would say is you don't have to go vegan to have the benefit to reducing risk, and also in terms of, there's only one paper that I've come across so far, and it's called the MIND diet, which is basically a combination of the Mediterranean and the DASH diet. And it was done in older people and showed that it potentially slowed progression of Parkinson's. Now, it's only associative, it's not causative, but again, you're going to get a lot of health benefit all around by following such a diet. So you don't have to go as strict as a vegan diet. The main thing I would say in terms of people going vegan diets is they have to be careful in terms of their micronutrient deficiency. So vitamin B12 is a big one that is deficient in people with Parkinson's. So I'd be honing in very closely and working with the dietitian to review your diet to make sure you're getting those micronutrients, because they are a really big part of keeping us well with Parkinson's.
Great, thank you. And thank you, Lynne and Richelle, once again for joining us. And thanks to Filip too for his excellent talk as well. I encourage you all to look at the further reading in the agenda tab. There's some great resources there to support the talks that you've heard this morning. I'm sorry we didn't get through all the questions, but we'll be happy to answer some of those offline, and please do email us at research@parkinsons.org.uk if we don't get round to answering them for you. Thank you, everyone, and enjoy the rest of the day.
Thanks, Lynne. Bye.